So today we are having one patient, trans male patient. He was born with the female features, and then later he realized he's not female anymore. So now he decided to become a male. So from last 1.5 years he's on hormone therapy. So now he has come for our top surgery. In trans male patients, in top surgery we do mastectomy. So basically removal of breast. So mastectomy can be done in two ways. Generally, if breast volume is more, if there is a huge size of the breast, then no option, we have to do double incision mastectomy. So if the volume is less and breast size is mild to moderate size breast, so we can give a try with using a keyhole surgery. That means we do a liposuction using a small keyholes and remove the gland with a periolar incisions. So in double incisions, we remove total breast along with the breast. We also remove the excess skin with the incision along the inferior mammary fold. So the incision sometimes it may extend up to the lateral chest. So in keyhole surgery, so we can avoid that long scar. So, but it only applicable for the small size breast and mild volume of the breast. So without any skin excess. So in this patient, you can see there is a small size breast. So we are planning to remove the breast gland and the fat using a liposuction, and we also trying to reduce a bit of skin like how we do in the mastopexy in the normal female breast. So using the periolar incision, we are trying to remove a little bit of excess skin around 1.5 to 2 centimeter of periolar skin. We will remove the skin excess and then we'll redrape the skin. So in this particular patient, skin draping is a major issue. So we have explained to him because it takes a long time since it's a young patient. So skin quality is good. So skin redraping will be very good. So we have explained to the patient that it takes 1 or 2 months for the skin redraping and then proper masculine chest features to develop. So now I'm doing a marking. So just like any other important gynecomastia surgery, we mark important landmarks. First we'll mark the midline, and then our port side. So generally we take a small incision in the anterior chest junction. So in this particular patient, it's very important to remove this under breast fold. This is typical prominent feature of female breast. So we have to remove this inframammary fold to make it flat. So we have to efface this inframammary fold between the chest and the abdomen wall. So that chest wall become very flat. There will not be any fold like it's a usual prominent features of the female breast. So we have to efface this inframammary fold to remove this fold. So through liposuction we can lift your breast. Yeah. So this is the inframammary fold we have to remove, and we'll mark the boundary of the breast so that we can remove all breast tissue and along the chest. And this is the muscle. So there is a little bit of excess fat in this over the muscle. So we'll remove this excess fat. And there is no lateral fat in this breast, no lateral rolls. This is the lateral extent of the breast. So up to here we will do the liposuction. So here we do little bit superficial fat removal because deep fat over the muscle is necessary for the typical masculine chest. So this much breast volume and the fat tissue we're gonna remove. This is on the left side, same thing on the right side. So, and again on the left side there is no lateral rolls. So this is the lateral extent of the breast, and we do a little bit of lipo on this area to remove this excess fat along the axillary fold and over the muscle. So this is the marking for us. This is the port side. Is a very small incision, very small holes. So with this small hole we'll infuse the fluid. So we'll suck out all the liposuction, all the fat and the gland. Most of the gland will remove the periolar incisions. It will be around the junction of areola and the skin. That will not be visible in the later date. So we'll remove that gland. After surgery, most important thing, we'll advise the patient for wear a compression garment that should be worn 24/7 at least for 2 weeks. After that, we drastically we reduce the duration of compression garment therapy. So at least next 2 to 3 months compression garment is very helpful in this particular patient, because there is a lot of skin excess. So to redrape the skin, to retract the skin, so it's very important to continue the compression garment. So we have explained all the things to the patient. So now this procedure we are doing under general anesthesia. It takes hardly around 1 to 1.5 hours. So after surgery, we'll shift him to the ward. So sometimes we'll discharge the patient in the same day. So we're not using any drain in this particular patient. So we can discharge on the same day. We'll follow up with the suture removal after 2 weeks for the suture removal.